Hello friends, I hope you all are doing great. In today's video, I am going to discuss about the reticulocyte count. So let's begin. First, reticulocyte count are the young or juvenile red cells released from bone marrow into bloodstream as the remnants of RNA and ribosomes. After staining with supravital dye like new methylene blue, RNA appears blue precipitating granules. Supravital staining refers to staining of cells in living state before they get killed by either fixation or drying. Reticulocyte count is performed to assess the erythropoietic activity of bone marrow. Now, the principle is the few drops of blood are incubated with new methylene blue, which stains granules of RNA in red cells. Thin smear is prepared on the glass slide from this mixture, and reticulocytes are counted under the microscope. Number of reticulocyte counts are expressed as the percentage. Here the specimen can be either capillary blood or the EDTA sample, and method is already discussed in principle. Now, how to count the retic count is the two methods. One is the Miller ocular disc. Here is the disc which contains two squares, one A and the B. A is 9 times larger than the B. We have to count retic in A square and RBC in B square. Then our formula comes as the total retic counted in square A divided by red cell counted in square B multiplied by 9 multiplied by 100 equals to our retic percentage. But the most commonly used method in laboratories are the manual methods on the smear, in which the 1000 RBCs are counted. Along with the 1000 RBC, we count the retic percentage also, and we report it as the percentage per 100 RBC. Contains ribosomal RNA. They can be precipitated and stained by supravital dyes, as already mentioned. Here's the method. This figure shows the retic. Automated retic count by fluorescent method, in which the substance such as thiazole orange that binds to RNA and fluorescence. With use of fluorescent technology, retic channel provides the accurate percentage as well as absolute count, and the improved immature reticulocyte information IRF for the earlier diagnosis, and the elimination of the interfaces like the Howell-Jolly bodies, Pappenheimer bodies, and immature retic to avoid manual count errors. Now, here is the flowchart. The first technique is the manual microscopy method, in which the marker is vital dye and instrument is microscope, which is generally and commonly used in medical colleges. While the other methods and newer methods are the optical light scatter, in the marker is also vital dye, but the instrument is hematology analyzer. While in fluorescent detection, the RNA specific fluorochrome and the monoclonal antibodies are used, which can be detected by fluorescent microscopy, hematology analyzer, or the flow cytometry. Now, the advantages of the reticulocyte count on automation are they give the quickly and they precipitate the basophilic RNA with the network of the reticulocyte, and the removed hemoglobin and unbound stain are removed by adding clearing agent, leaving the clear spherical mature RBC and darkly stained reticulocytes. The normal range is 0.5 to 1.5%. The principles used in automation are the light scatter, direct current measurement, and opacity. The other parameters, as mentioned, can also be measured on automation. Now, the stages of reticulocyte maturation. It will be staged from stage 0 to stage 4, while the stage 0 is the orthochromatic normoblast, which is not an retic. Stage 1 contains the dense cohesive reticulum, which is around of 0.1 percentage of total retic. Then stage 2 is the extensive network of the loose reticulum, which is around 0.7%. Then the stage 3 is the small reticulum along with the granules, which is of 32%. And the most commonly seen on the smear are the stage 4 or the scattered granules, which present around 61% of total retic. Now, the different parameters of reticulocyte are the corrected retic count, or also known as reticulocyte production index. The formula for the corrected retic is the retic multiplied by patient's HCT upon normal HCT. For calculation purpose, normal HCT is taken as 45. So by this formula we can count the corrected retic. Now the reticulocyte production index is counted depending on the maturation of the reticulocyte count. So here it depends on the packed cell volume of the RBC. So according to packed cell volume, here is the table, the maturation time in the days. We can remember like 15, 25, 35, 45, and the maturation day is decreasing as the PCVs increase by 2.5 to 2, then 1.5 and 1. So we can easily remember this table. So we can count the reticulocyte proliferation index by the counting the corrected rating divided by the shift correlation factor, by which is in days. And now the counting absolute reticulocyte count, reticulocyte percentage multiplied by red cell count. The normal range is around 50,000 to 85,000 per cubic mm. Now, the reticulocyte. As I have already mentioned, the increase in retic is suggestive of active erythropoiesis. So it can be increased in cases of hemolytic anemia, thalassemia, response to iron or B12, any type of hemorrhage, erythroplastosis fetalis, and the leukemia. While the retic count is decreased in aplastic anemia, megaloblastic anemia, anemia of chronic disease, myelodysplastic syndrome, and radiation. Now here is the image which came to our hospital. Here we can see the retic in this smear. 3, 4, 5, 6, 7, 8, 9, 10, 11. So retic in this patient given is around 11 to 12 percentage, and this is the case of CML. As I have mentioned, the leukemia is one of the cause of increased retic. These are my references. Thank you.